Functional communication training. We are getting into this topic today. I had a delightful conversation with Dr. Bethjoy Houck from University of North Texas is where she is working. And she had a really wonderful article in a publication called Behavior Analysis and Practice, called A Practitioner's Guide for Selecting Functional Communication Responses. She talks a little bit about assessment. She talks about who is a good candidate for functional communication training, and then gives 5 recommendations around this area, which I think is so very important. One really highlight that she shared, which I have seen clinically, is other responses, even if the client is verbal, may be needed. Sometimes when we're working with others, they're like, well, this student is talking, like we don't need to give them a picture or a device or another way to communicate. But we're going to shed light on that topic because I've gotten into disagreements with other staff members about that. Dr. Houck received her bachelor's degree in neuroscience from Johns Hopkins University in 2008 and her master's degree in autism and developmental disabilities from the University of Texas at Austin in 2009 and her PhD from the University of North Texas. She also shared that she has a brother who is autistic and she is just very passionate in the field. This is really great information, whether you already know what functional communication training is, you think you do, you think you're doing it in your clinical or your school environment. This is going to shed some light on the topic. Let's get into this conversation.
You're listening to Autism Outreach Podcast, a podcast full of ready-to-use strategies to help those with autism strengthen their communication skills. Here's your host, Rose Griffin of ABA Speech, a speech therapist and board-certified behavior analyst who shares tips you can use in your next therapy session.
Welcome to the show today. We have a wonderful guest, Dr. Bethjoy Houck. Thank you so much for coming on to the show.
Yeah, thank you for having me. I'm excited to be here.
And I was telling you before I pressed record that something that I do, because I guess I have time with my small business. I am a treating clinician 2 days a week, but I do have this business, ABA Speech, is I try to dig into the research and try to bring it to either social media, because that's where I have a lot of followers, and here on the podcast, because as treating clinician, it's very hard for people to be digging into the research as we should be. And that is where I came across this really cool article that you talk about functional communication responses, which we have talked about in indirect ways here on the show, but I think it'll be nice to tie in this article as well. But you're new to me and my listeners as well. So can you tell us a little bit about, how you got into the field and, what you're up to now?
Sure. So I got certified in 2009. I came into ABA thinking that I was pre-med in college. I wanted to be a neurologist. I have a brother with autism and a lot of health issues that definitely contributed to his diagnosis. Mm-hmm. And so I thought I wanted to go the neurology research route. And ended up kind of by accident working at a young autism project replication site in New York, and absolutely fell in love with EIBI and the progress that these kids were making. Mm-hmm. So that was my introduction to ABA. At that point, there were no BCBAs. That wasn't even a thing yet. So there was no BACB and all of that. They weren't really behavior analysts. This was a group of special ed teachers that were trained in these teaching procedures. Mm-hmm. So that was my introduction. And then from there, I ended up working. I went to college in Baltimore for my last 2 years of school and ended up working in Kennedy Krieger's neurobehavioral unit. Mm-hmm. For their outpatient clinic for problem behavior. And that was where I really fell in love with working with kids and adults with problem behavior, and also had my first experiences in more of the medical research side of autism. And that was not at Kennedy Krieger. That was just at another lab that was affiliated with Hopkins, and realized that was not for me. The direct client contact, training parents, training caregivers, mm-hmm. and seeing those changes was really what I loved. So from there, I did my master's at UT Austin, and then I worked for 10 years in clinics, in home schools, before I came back and did my doctorate at UNT.
Oh, interesting. Okay. I lived in Austin. I was reading that in your bio before I pressed record. I lived in Austin. I'm in Ohio right now.
Okay.
That's where I'm from. But we lived in Austin when we got married. We moved to Austin and I lived there for 3 years and I worked in Leander ISD. I was an autism facilitator and support specialist. And I loved it because
I had a couple of kids over there and Austin is like flooded, I feel like, with BCBAs.
Oh, I can imagine. Yeah. And what was so cool is that I was doing this role that in essence was kind of like a BCBA. It was perfect because then I did my classes at UNT, actually online course sequence. And then my supervisor was Kelly Rich, who owns Central Texas Autism Center. And it was so cool because I would go once a month to the speech therapy meeting. There were like 35 speech therapists at the time. And I'd do a little spiel about something that had to do with ABA and speech therapy. And then the rest of the month, I'd go in to people's therapy rooms, classrooms, we supported teachers. And it was just such a perfect way to get my supervision hours because in essence, I was acting, and this was many moons ago, as a consultant, you know, with Kelly to support me. She was actually coming into our district at the time and doing a day-long workshop every single month that was just, it was like graduate level coursework. I mean, it was just really like, she's cool. She's been on the podcast too. I'm friends with her and she's a colleague, but yeah, it's interesting. Yeah. I mean, a long time ago, it was just CTAC. And then now I know Austin is different now. So,
now it's exploded.
Yes, there's a lot of providers. Just like the field though, like you said, you kind of got into it before there was the BACB. I always tell people because a lot of speech therapists and BCBAs have trouble getting along. And I try to make these kind of edgy Instagram posts sometimes. And I just want to be like, well, we better collaborate now because we're coming and we're multiplying, right? We're coming. So I love that. Interesting. So let's talk about this article that I had unearthed on, I think it was in JABA, I believe. And
it's in BAP.
It's in BAP. Okay. That's a good one. Behavior analysis and practice, which is really awesome information. And I've had a lot of people on that have published in there because I feel like it's actionable to clinical intervention. And so it is, it's easier to read. I think it's easier to digest. If you're somebody who's listening and you're like, oh, I want to go straight to the articles. This is a really good one. So it is called A Practitioner's Guide for Selecting Functional Communication Responses. But can you give us a working definition of functional communication training, if that is a new term for anybody listening in?
Yes. So functional communication training is a procedure where the clinician, and I'm going to say is attempting, because that's our goal, right? But that's why we're taking data, so we know if it's actually working, is attempting to replace some problem behavior or a set of problem behaviors with a communication response that accesses that same reinforcer. So that's kind of like the book definition, right? And I think the things I run into in practice, a lot of times I'll see programs or have students that are working in programs where they say, we're doing functional communication training. And what they really mean is they're doing man training. So making sure that we kind of get that distinction that once we're at FCT, we're really acknowledging and saying like, hey, there's a problem that already needs to be replaced. There's something that we need to make a trade and get a different response going.
Yeah, I think that's important to talk about. I always say in my trainings when I go to these conferences, I'm trying to go to one conference a month and present. But I always say, I was on this panel with Dr. Sarah Frampton. It was such an honor at NAC last month. And I always say, I have people on the podcast and they're very, very smart and they're PhDs, but I have them start with a baseline definition of what we're talking about because I never want to assume that everybody really knows what functional communication training is. It's like, oh yeah, that was on the behavior plan and we're doing it. Or we always do that in that classroom with that teacher, with that kid. And it's like, well, why? And what is it? And why are we doing it? And are we doing it correctly with fidelity? As you say, there's a lot of room for error when somebody makes a plan and it's based in research and then somebody trains somebody and then somebody moves on, they leave the district and then we get somebody else in. You know how it goes. It's hard to have that fidelity. So what students are good candidates for functional communication training then?
So this is really going to be for anybody who has socially maintained problem behavior. So anybody that we have already done that assessment to figure out that their problem behavior is maintained by some form of attention or some item that they want access to or escape from some task that they don't prefer, or a combination of those things potentially. But this is where, one, when we do have those problem behaviors, we want to make sure we're doing a really good assessment to determine what the function of those problem behaviors are. And we have to do that if we're going to do functional communication training. I think part of the strength of functional communication training is that you're already identifying what is this problem behavior? What are the conditions that make this problem behavior happen? And then what is that reinforcer that turns that problem behavior off? Because the difference between, man training, I can do things to try to see if the kid is interested in this toy. For some kids, I might have a really good idea of if they're interested in this toy before I prompt that request. But with functional communication training, you've already established that when I put this child or this adult in these conditions, they want this thing or they want this attention. And then I really know when I go in and provide that prompt or do that training ahead of time that I'm prompting the right thing, because I'm setting up that whole situation that in this context, there's only one thing available. So I know for sure that I'm in that sense kind of prompting the right man, because that's what's so difficult about man training, right? Is we're really guessing about what somebody else wants. And then if that behavior persists and we can get it going and keep it going, we're probably right. But there's always a little bit of guesswork there.
Yeah, absolutely. And I think that's important to talk about. So as a practitioner thinking, okay, we need to have an FBA. We need to understand exactly why the problem behavior is occurring, right? Sometimes that can be hard for school-based SLPs or, people like, we have to have the FBA first, people. We have to know why this is taking place. So somebody that says like, oh, we're doing FCT and maybe there was no FBA, there's no behavior plan. It's like, are you really?
You're like, well,
are you really? Okay. So that's good just to take it a step back, because I know I always tell speech therapists, I talk about behavior a lot as a barrier to learning, and just talking about like, well, who can do the FBA and what does that mean? And these are the functions of behavior, because what's wild is speech language pathologists, we don't learn about any of that. And what's crazy is we're serving students who every single day engage in behavior that is a barrier to their learning and safety at times. So this is important, people. So what should we consider as practitioners when analyzing functional communication response selection for our students? In the article, you talk about some different recommendations, and I thought maybe we could just talk through them, as I thought they were pretty interesting and actionable for people listening as SLPs and BCBAs.
Yeah, for sure. So one of the things that we talk about in the paper is a couple of assessments that do already exist. So we talk about an assessment that was published by Ringdahl and an assessment that was published by Valentino. And those two assessments, one, the Ringdahl assessment was looking at really the very first recommendation that we make as far as talking about what responses can I easily prompt for this learner. Some kids are going to do really well with us prompting them to touch a picture card. Some kids that I could prompt to touch a picture card, I may not be able to prompt to hand me that picture card. Or I may not want to prompt them to do that for some reason. Maybe that is really aversive to them. So that Ringdahl assessment gets specifically at, with the responses that I can prompt, because I can't prompt a verbal response, which is often why we include some other response other than verbal, even if the learner's verbal. And even if the learner's verbal, if hitting themselves is easier than saying a word, then I might still need that other easy to prompt response, even if they can talk. And
that's a great point, because I love that, because some people will fight you on that and say like, well, why? The kid's talking. And, I spent a lot of time working in non-public programs, and I never forget, I had a client who was just 99% of the time was really delightful, and then 1% was not. And it was unsafe and, aggressive behavior and things like that. But I remember I made a phrase chart for this particular student, and we worked through what potentially could be on there. I know it's probably not exactly the same, but it was similar in the fact that I was educating and coaching staff on like, yes, this person can have a full-on conversation with you, but when they're in the moment, they're going to point to this phrase. Do we want them to be able to say the phrase 100%? But in the moment, do we want to make sure they can communicate, and then we can kind of work through what is taking place instead of them spending the rest of the afternoon in a safe room because it's unsafe for them to be around other peers. So I think that's a great point to bring up.
And I think we do this for ourselves too, right? Like I wrote this paper. I still have my little notes that I want to look at because I know that when you ask me a question, I might be, frozen for a second if I do that. And I have a daughter who is in 3rd grade and she has arthritis and she has a card for herself for when she's in pain. Because when she's in pain, she can't talk very well or come up with, hey, maybe my heating pad would help, or maybe my, foot bath would help. She needs that cue card. And so I think also just putting it in those terms of like, hey, we all do this. So let's get those materials prepared for someone who might be able to tell us if they just had that cue card. So having something that you can prompt is really important. And that Ringdahl assessment, I think, is a really good breakdown and a good way to evaluate kind of which responses might be the easiest to prompt for different learners. And then thinking about so then kind of the second thing is thinking about any of those responses that might be incompatible with the problem behavior. So there was one of the papers that we had read that talked about this was the card for requesting to go somewhere was attached to the therapist. So rather than having the child carry their card, the therapist wore the card. So the problem behavior was elopement and the kid could not run away from the therapist and go touch the response card. So it kind of created this automatic contingency of like, I have to be close to my therapist to ask for this thing that I want, and then I can go get it. So I thought that was a really creative, incompatible response. I think a lot of times we think more about, you can't aggress towards me while you're getting your card off of your textbook or something like that. And sometimes that's true. Some kids are a little too creative for truly incompatible. But that's another value of having the picture or the iPad over the vocal. So just because you're verbal and you can say that you want to play with your iPad, maybe you can say that you want to play with your iPad while you punch me in the head. You can't get your card and tell me you want to play with your iPad while you punch me in the head.
Right. Yes.
Adds a little bit of a slowdown there.
Yes. Love that.
And then the third one was thinking about responses that allow for response restriction. And this one, I have mixed feelings about this because I have very strong feelings about response restriction in general. I do think that there are times I have had learners that I've done this for where if their request card is available to them and they request for the item and you have to say no, we lose that request and we have to reteach it because just that one time of us saying no. So sometimes we have had those learners where we say, okay, if it's not available, we need to remove the card and they just can't ask for it.
Yeah.
But I also feel like for most learners, and I think we have an obligation to try to get people past this. I usually tell my students, if he was saying the word over and over and over again, you wouldn't put a piece of tape over his mouth.
Right.
So don't take his communication board. Don't take his iPad.
Right.
Don't take his words unless we have demonstrated and we know for sure that there's no other way to keep everything where it needs to be and keep his requests going and keep his behavior safe and things like that. So if you do have a learner that you've got that history already established that you know you're going to have to remove the request, then you probably don't want to go with sign language or a vocal request because you're not going to be able to remove those from the environment.
Yeah, that gets hard for kids when they ask for things that are not available. Or, that gets into a whole other type of intervention. But I think it's good that you're talking with students about just the importance of AAC, because I do a lot of consulting kind of internationally and here in the United States. And sometimes a student will have an AAC device, but it's not with them in the room
with
and
them.
just like very simplistic. I haven't encountered that in a while, but I do think that sometimes AAC just scares people. And we need to embrace it. That's the only way to get over it. And the kid always needs to have it. Yeah, and that's something that comes up all the time. What if they're asking for it all the time? And there are different things you can do on an AAC device that I think are ethical. You could put it like they have to touch it for a little bit longer to be able to request that item and things like that. And I think that's important. But yeah, we should always have it readily available. We can't take it away. We wouldn't tape somebody's mouth shut, obviously. So the fact that you're talking about AAC, I love that.
The other one that always gets me is like, this is my AAC for at the clinic and this is my AAC for at home. It's like,
yes.
No.
Or when they're making a folder that says ABA therapy. It's like a whole motor plan. Like, I don't know if you know, Dr. Cindy Gavarder is this BCBA PhD, and she has come on the show, done courses, and here's a lab, and I think she does AAC research, but it's interesting. It's like, it's a whole motor plan. We can't just have the one folder that says ABA. Yes. It's like, no, those words are in there. Yes. We need to find with the word finder where they're at. Yeah. And there's a lot of growth there. There's a lot of growth there, but I do a lot of training on that are ACE courses about just intro to AAC. So that's cool that you just brought that up organically.
It's an important thing.
It is very important. Yes, absolutely.
Okay, so then the fourth thing that we talk about is making future responses as specific as they need to be. So what you will see sometimes is that like step one of FCT might be, if someone wants my attention, talk to me, play with me, something very generic like that. And a lot of times initially, that's what we need. We just need to do a very simple replacement of this is what gets me to talk and interact with you, and this doesn't anymore. Right. This problem behavior is not going to work. Here's the easy response, and I'll give you everything for that one response. But making sure that we're not ending there and thinking about how we can start to make those responses more specific in our early planning for FCT. I think is really important. So one way that we'll do this in our clinic right now is when we do have a kid who we're working on tangible FCT with and we're teaching requests for things, we'll just do a quick preference assessment at the beginning of each session. So we're not always necessarily teaching. Some kids can't handle this, but for some of our kids, we can do that. And then we can pick that item, and that's the item we're running FCT with, rather than just having a card that says food or toys, and then I give you a bucket with your whole life inside of it. I want you to tell me, which toy do you want? Which food do you want? And we can still practice that where we say, okay, it's M&Ms that are available because that's what came out the highest. We're going to work on M&Ms right now, and have kids ask for M&Ms and get M&Ms instead of asking for food and getting M&Ms and asking for food and getting Oreos and asking for food and getting a hamburger. Starting to really think about how we can separate that out and start building more different responses. And I think focusing on, and I think the man training literature does a really good job of talking about this, where we haven't talked about it as much with FCT, that really we want that variety of responses way before we want the phrase to be longer. I would much rather that someone be able to say, Oreos, Skittles, play with me, cars, rather than I want cars, please. I don't care. That is not something that we need. I need you to have a big world, not one long phrase that only gets you access to one world.
Yes.
And I think tangible items is the easiest way to do that, but thinking about it with attention too, because sometimes you do want somebody to laugh with you, and sometimes you want somebody to cry with you. So teaching kids to ask for, chase me, tickle me, talk to me, talk about a specific topic. Most of our kids, especially our kids with autism, have some pretty specific things they like to talk about. Like, let's go ahead and capitalize on that and start teaching talk about Thomas the Train, talk about whatever their favorite things are, and start teaching differentiation of different types of attention.
Yeah, I love that. And I just presented at FABA. Is that this month? Yeah. Today's September. So yeah, I presented at FABA this month about SLP BCBA collaboration, the ethics of that. And somebody came up to me and we were just talking about AAC. I think they had worked with another duly certified person and they were just saying, wow, it's so cool that you're duly certified. And, I worked with this person and they were just showing me with the student's AAC device that instead of just running programming, like I think we would call that, in the ABA world, maybe speech therapists would say goals or objectives, that we could use the device to just comments about Thomas the Train and say oh, it's blue or he goes fast and things like that. And it was so interesting to me because that is really ingrained in how I provide intervention. And it's probably because I'm a speech language pathologist, but it was good for me because I do a lot of ASHA and ACE training for speech therapists and BCBAs. Sometimes you think oh, this is really simplistic and I don't need to go over this, but I'm no, we're talking about really simple things, but these simple things are what are so important because if we knew just the stuff that you were saying right there, that's intervention. I always say it's a science, but it's also an art form. And this is why it's hard with the field that we're in with BCBAs, training RBTs, and how the field is growing so rapidly, that it's easier to sit at a table and do discrete trial instruction, and which I think has a place. But when we get really nuanced about what you're even just mentioning on a whim, you said there about talking about Thomas the Train, this is the stuff that's more nuanced. But this is the stuff that is going to help with also the discrete trial instruction. There's going to be some mix that's important for kids, but we can just, incidentally work on language. And I think sometimes people don't maybe feel comfortable if it's not on the data sheet or if it's not rotely there for them to do. But this is really the essence of helping somebody increase their spontaneous communication. So I think it's cool you mentioned it.
And it's so much easier with the technology that we have available now. And, I remember going through magazines at my first ABA job. So you could cut out pictures because you couldn't go to Google image and type it in. We're taking it back, people. We're taking it back. Yeah, no, I remember too. I want to take all of my students and just put them in a room with magazines and be like, okay, now make your emotions program.
Right. Yeah, exactly.
We'll make it. And now tell me how thankfully
get your JCPenney's catalog and get the scissors and let's flashcards and let's go. Let's go to the laminator now. Yeah. Oh my gosh. So that's true. That's a good point.
But with technology and these different communication device apps and things that are available, one of the things with the commenting that you said made me think of this. We have a girl right now who she really uses YouTube to communicate quite a bit. Yeah. And she'll go and she'll find the phrase that she wants to say in some video, and it can get tricky because at school, they're she can't be on YouTube all day, but it's it's part of her communication system.
Right.
So just having staff write down the things that she's going back to so that we can put those buttons on her communication device and show her okay, school's not going to let you have YouTube, but now you have this clip of that thing that you want to say on your device, which would have been, so difficult.
Oh, that's interesting. And actually, that's interesting. I actually had two people on. One, Dana is a BCBA getting her PhD, and then Dr. David McNaughton. But the one thing they talked about was AAC visual scenes. You'll have to listen for that podcast episode to come out. What's interesting is even for this particular kid, this is why it worked for me. I have not used it clinically, but I think it has a lot of implications where you would just maybe see that video, take a picture of it, a screenshot, and then you can record these hot buttons where it would say the phrase. And that would be a nice supplement to then maybe paring down to just the text or something. But I think it has a lot of implications for therapy, and it's something that could be so easily done. Oh, she really likes this. And that's what's hard about therapy is it's specific. We can't, I sell, the action builder cards. That's how I started my business. It's 100 set of cards for generalization of phrase construction, but I used to do Google Images and talk about trainings about no, we need 3 examples of the apple or the pizza or whatever we're working on because unfortunately, it's not that easy. You can't get everything in a deck of cards or an established curriculum. They obviously help, but we have to be more spontaneous, just like you're saying with this individualized learner. It's, hate to break it to everybody, it's individualized and it does take a little bit of time, but the technology, it helps. Yeah. It helps a lot. Amazing. I love that example.
And not just for things that that we want kids to say,
right.
You know, one of the things she goes back to frequently is this song that talks about, it's like yelling at someone about being a dictator. And she plays it when she's really mad at me. Like when she's kicked off at me, she's like, goes to the dictator song.
Right.
And like that needs to be in her AC. She should have the right to call me a dictator if she's mad at me. Like,
yes,
that's fine.
Yeah. Right.
Let's give her that space. So.
Yeah. Communication Bill of Rights. That's another nice resource that is out of ASHA. I don't know if you've seen it. It's called the Communication Bill of Rights. But I love to share that too, because sometimes you'll have people that'll be like, oh, well, they were saying too many things. And then the AAC device gets turned off and put in the book bag. So, well, that's exciting that you see the power of AAC. I love that. Well, this was good. And so we went through the 5. Did we get through all 5 steps that you had?
I think the last one kind of ties into this, just the FCRs that are going to be the easiest to carry and maintain. You know, and I've had kids recently who need pictures and they need to hand a physical picture to someone. But if they don't need it, let's not make kids and parents carry around books of 1,000 tiny little pictures that they have to put out and find and pull out of the laundry and all the rest of it.
Yes.
And then I think the last thing that I wanted to like throw out that I have not seen too many places is object exchange. Thinking about using objects in creative ways as communication responses. We had a guy that we could not get any requests taught, but he could feed himself. And so that's what we ended up using, an empty soda can, and it was attached to him. And when he picked it up and tried to drink out of the empty can, we knew, okay, he's thirsty. Let's get him a drink. And so just really looking at what can this person do and how can we use that as a communication response.
I love that. Very helpful. I love that. I had a kid once that we used, he had a static device. It was a Go Talk, and he had a lot of high support needs, and we put the actual item on there. And same idea. It's just really trying to understand, like, what do you really want? So that student can spontaneously communicate. And that's out of the box thinking. I feel like that's so important for us to think like, well, no, this hasn't been done before. Or maybe we haven't done it in this situation, but this might be a really nice first step for that student to then become an independent communicator. I love that. Well, thank you so much for coming on to the podcast. I'm going to say the name of the article one more time, A Practitioner's Guide for Selecting Functional Communication Responses. I think this was really important information where you can just listen to these steps, kind of understand what is functional communication training, and are you doing that in your clinic? And does it check all the boxes that we discussed? And if you're not, use this as a good baseline to make your systems a little bit better. So thank you so much for coming on the show. It was great to connect.
Yeah, thank you.
Thanks for listening to Autism Outreach. If you enjoyed the show today, make sure to subscribe so you don't miss an episode full of actionable strategies you can use in your therapy room. Write a review too. That would mean so much to me. I always love hearing from you. Have a specific topic that you want included on a future show? Reach out over on Instagram, ABA Speech by Rose, or visit me at www.abaspeech.org.